Assalamu alaikum. Thank you for taking the time to attend and listen to this short talk about legalizing assisted dying in the UK. This is important information for Muslim communities. This talk is being given on behalf of the British Islamic Medical Association by myself, Dr. Nadia Khan. I am a palliative care consultant in my background, so my professional work is to give medical support and care for patients whose illness cannot be cured and those coming to the natural end of their lives. In this webinar, we will be covering the following questions. What is assisted dying? Would assisted dying be legalized? Why is assisted dying being introduced? Are the arguments for assisted dying valid? What are the dangers of assisted dying? What are the professional concerns and what has happened in other countries? And finally, what do we need to do next? First of all, it is very important to understand exactly what is being discussed. Assisted dying is an umbrella term which can mean physician-assisted suicide or euthanasia or both of these things. The phrase is used differently in different places, so it is important to look at the detail of what is being suggested. Assisted suicide is when the healthcare system and staff have the ability to give patients lethal medicines with the intention that they will take it and end their own life, i.e. suicide. Euthanasia is when healthcare staff directly administer the lethal medicine to end a person's life. Usually assisted dying is related to people with terminal illness who have the legal mental capacity to make decisions. Assisted dying is different to palliative care. Palliative care is an approach to reduce suffering as a patient reaches the natural end of life. It does not seek to hasten death. Will assisted dying be legalized in the UK? And even if it is, why should we be concerned as Muslims? Assisted dying has been put forward many times in Parliament over the last 20 or so years. However, once again, this is being put forward for discussion with a significant risk of being passed, as Keir Starmer has already stated that he is in favour of assisted dying being discussed and legalised. The bill is also due to be discussed within the House of Lords in the next month. You may question, why is this even an issue for Muslims to be concerned or worried about? If it does become legalised, as long as it's not forced on us, then what's the problem? My answer to that is twofold. Although we will not accept assisted dying personally due to our religious beliefs, at the same time we do have a duty to speak out for the greater public good. In addition, although the Muslim community is unlikely to directly accept assisted dying, there will be indirect consequences for all of society and healthcare, and so the practical and ethical concerns we have for society need to be voiced. These concerns are not just for religious communities, but also people of no faith as well. So why is assisted dying being introduced? There are two fundamental reasons given as to why assisted dying should be legalised. Number one is the need to end suffering at the end of life, and there is a fear of suffering, particularly when there is no greater purpose in it. And this is the case for societies where there is no religious explanation or understanding as to the meaning of suffering. Number two is the argument of choice. There is a fear again of losing control, and this is linked to a lack of dignity, particularly within the Western societies. Whilst I'm sure that for the vast majority of the British public, they hold concerns about people suffering and having choice, these concerns are with the best of intentions. However, it's also important to note that there are wider facts which may influence policy on assisted dying, such as the cost of healthcare for people in the last year of life, and the widespread financial pressures, particularly affecting health services and hospices, where services up and down the country are being cut. So are the arguments for assisted dying valid? When it comes to relief of suffering, of course, anyone would wish that suffering related to end-of-life care is alleviated and a person's comfort and dignity is prioritised. However, at the moment in the UK, High quality, around the clock palliative care is not available for everyone. There are differences according to where you live, and also between the services available during the daytime and those at night time. There are not enough staff in healthcare, particularly in palliative care, with the right training. And we know that palliative care is effective at reducing suffering in terminal illness. So this needs to be made available for everyone equally in order for there to be true choice about assisted dying. Number 2, when it comes to the idea of choice and control. Legalizing assisted dying due to choice cannot come at the cost of putting others at risk or restricting others of their own free choice. And there is implications for assisted dying, which I'll talk about in the next few slides when it comes to other people's choices being restricted. So what are the dangers of assisted dying? There are many concerns and problems with assisted dying, but one of the key important ones is the spoken and unspoken pressure to undergo assisted dying once this is normalised within society. And this is likely to impact particularly those who are most vulnerable, the extreme elderly, those who are homeless, those who have poor social support and family networks around them to help withstand illness, and those who have chronic unremitting illnesses. It's very concerning that they may feel that their illness and their lives are a burden on others around them, including their family and the care systems, and therefore they will be better off dead. Communities who already have poor experiences of healthcare may further question the motivations of a healthcare system that incorporates assisted dying, and this is particularly the case for minority ethnic groups and disability groups as well. If there is increased worry and reluctance to seek care because of the fear of assisted dying being considered or even pushed on patients, then this will lead to widening healthcare inequalities and worsening healthcare outcomes as people reduce down access. More broadly, we know that the majority of healthcare costs for our system are for those people who are in the last year of their life. If assisted dying is normalised and even preferred as an option, then healthcare systems will not be incentivised to either fund or improve the services and support, which may be more expensive than giving assisted dying, and also the treatment options for these particular patients. Again, even more broadly, once society normalises the idea that some stages of life or types of life are not worth living, this will have a ripple impact throughout our society's policies, the types of services that we set up and how they're set up, and the institutions that are in place within our infrastructure. I won't go into too many details around the professional concerns, but it's enough to say that there are many concerns. It can be very difficult to predict when death is near, and given that people with a prognosis of 6 months or less are being suggested to have the offer of assisted dying, this can be very difficult even at 6 months to say whether that will be accurate or not. It's difficult for healthcare professionals to ensure that a person has mental capacity, because mental capacity is not a black and white subject. There are lots of things that can affect mental capacity, some that can be assessed very easily, but others which can't be and require time, expertise and skill, which not all professionals have the training to do. It may particularly be difficult for healthcare professionals who meet a patient once or twice to assess whether the patient is not being coerced or having pressure put on them by other people around them, either within the family or in their wider community networks. There are, of course, ethical concerns for healthcare professionals that assisted dying is against the reason why they entered the profession and what the profession is there to do. Other concerns are that many healthcare professionals will end up having to be indirectly involved in terms of making referrals to the system, even if they don't want to be implicated. We know that there can be medication complications during assisted dying, which has been the experience in other countries. And there is a concern in healthcare professionals as well that the communities that they are wanting to serve and care for will end up trusting the systems even less. So what's happening in other countries? Several other Western countries have legalized assisted dying or euthanasia, and particularly thinking about the experience of Canada, they have found that the proportion of deaths now which happen in the country are increasing significantly due to assisted suicide and euthanasia. The reasons for assisted dying are now being widened as well in other countries. So people with chronic illnesses which are not life-ending, people with psychological reasons including autism, and even children are now being provided access to assisted dying on the grounds of equality. In one particular area, a reflection period or a cooling off period, which allows people to make the decision to have assisted dying, but then to have some time to think about it, that reflection period has been removed. There are now also increasing concerns around stories of coercion and people being pressurised to undertake assisted dying because of social problems, even financial issues, and of course pressures indirectly from loved ones alongside even healthcare staff. So what's happening in other countries where assisted dying has been legalised? What we found is that there is an increasing percentage of deaths which end up occurring due to assisted suicide and euthanasia. So for example, in the Netherlands, 5.4% of deaths in 2023 occurred due to assisted dying. Just to give you a sense of the scale, if that were the case in England and Wales where we had assisted dying, that would be equivalent to having over 31,000 assisted deaths in a year, which goes to show that assisted dying does not remain for the few exceptional cases as is advertised, but instead becomes normalised as part of society. The reasons for assisted dying are also now being widened. So people with chronic illness, not life-limiting or terminal, children and people who want to have assisted dying for psychological reasons are now being offered that access under the banner of equality. The reflection period between asking for assisted dying and assisted dying actually taking place has been removed in certain jurisdictions as well. There are now increasingly concerning stories coming out of different areas, such as Canada, where patients who have disabilities or psychiatric or psychological distress are, instead of getting actual support for their underlying issues, are offered assisted dying as the solution instead. So what do we need to do next? It's important that people and communities organise to have their voice heard on this issue. Raising awareness is key, and also understanding that this is a very time-sensitive issue. Assisted dying will be discussed within Parliament in the next few weeks to month or two, and so we need to act now. Please think about getting in contact with your constituency MP to share your views within the next few weeks. You can write to your MP, but even better would be to have a face-to-face meeting with your MP where you can prepare your points beforehand and explain your feelings about the introduction of assisted dying and the impact it will have for the communities and people that you love and are a part of. For further information, please visit the British Islamic Medical Association website where there is an assisted dying section. And for any questions or feedback that you have, please email us at info@britishima.org. Jazakallah khair for listening. and Assalamu alaikum.